Hello everyone and welcome again to the Doctor Show. This is Dr. Zahra Al-Jumaili and I'm here to answer your questions, to talk about medicine and the general healthcare that we should always have. If you have any question at any time about anything medical, please, you can ask me on social media. You can check our social media, our YouTube, our Instagram, and our Facebook to ask whatever you need. Today we're going to talk about something a little bit dangerous, which is heart attacks and how do they happen. So heart attack is something very dangerous that people have, which could cause to immediate death or death later on in life, and it's very dangerous to have. What is it and why does it happen and what do we do to prevent it? So heart attack is basically, before we talk about what is it exactly, let's talk about the heart. A heart is an organ. It's basically filled with muscles that the only function of it is to pump blood all over my body. So it keeps me alive. It literally keeps me alive. So what does this heart muscle need? It needs its own blood vessels, its arteries and veins to keep on giving the heart itself blood and then to the rest of the body. So the heart itself has a little bit of arteries and veins all around it called coronary arteries. So when we have heart attack, those small arteries, we can have obstruction in one of them, could cause to a stoppage of the blood to the heart itself. And when the heart does not have enough blood, it could dysfunction and it could work like it could have a bad way of you having a proper blood pump, and eventually it could lead to death. But why would a blood clot happen and why does it stop from having a blood clot? If you eat a lot of fatty food and have a lot of cholesterol, a bad type of cholesterol, which is an LDL, and if you have a lot of triglycerides and a lot of fats in your food, you might, those fats, if you cut your artery and it's circular, those fats will make it small, up to they make it very, very tight. When they are very tight, any small plaque or any small clot could actually stop it and could make you because this clot could not pass by and can make you stop the heart passage to the blood passage to this portion of the heart, which could cause you to have a heart attack. Unfortunately, it happens a lot because the lifestyle of most old people was not as healthy as we want it to be, especially in the culture we live in. Our food is always fatty. It's not actually in our culture to have a lot of exercise and a lot of daily walks and all of that, which we need to solve immediately. So what do you feel if you have a heart attack? Just like the movies and just like all what we know, there is a lot of tightness in the chest, there's a lot of pain in the chest, and the pain could go to your arm and actually to your left arm. It could go to your left arm and could go to your jaw on back. So it's not necessarily just a pain in the chest or the arm. It could actually go to other places. And by the way, the severity is a variant from one person to another. Sometimes people feel extreme pain, sometimes people feel slight pain, and sometimes people don't have symptoms at all. But the more the severity, the more the chances you're having a heart attack. What other things could be cold sweats, could be shivering, could be having discomfort in general, and a person might feel it if he has or she has a predisposing cause. So all of that, when this happens, what do? We immediately call the emergency. We call 911, we call the emergency in whatever the number of emergency is in your country. We call the emergency department immediately. And if you're healthy enough to drive, you can drive yourself immediately to the hospital to get yourself checked, to get a heart image and a heart picture for your heart, and do a blood test to make sure that your cardiac enzymes are a normal level. Sometimes it could be a false alarm, sometimes it could be just a a chest tightness that you had in your body. So you have to go immediately to the doctor. You have to go immediately and take, if you're a person around you have it, you have to go to the hospital, to the emergency department in the hospital, not just any doctor, not any clinic, because they need to have the machines to make sure you're fine. So all in all, we need to know why does it happen and what are the predisposing factors for me to how to prevent it, what causes it. One of the big reasons to cause it is the age. So in women, in men, actually, the age above 45, we need to get regular checkups to make sure we are healthy, and in ladies above 55 is a predisposing factor to having heart attacks. Also, tobacco smoking. Cigarette smoking is one of the leading causes to heart attacks because the nicotine causes you to have a vasoconstriction, which means a lowering in the diameter of the blood vessel and having tighter blood vessels. What other things? High blood pressure. A lot of patients with already high blood pressure, they're more susceptible to having heart attacks because the arteries, the walls of the arteries are too weak. They could actually collapse, or they just get diseases very easily. High cholesterol level. I told you guys before, high LDL, bad cholesterol level, high fatty food, high cholesterol in our body could cause you to have heart attacks. But on the contrary, the good cholesterol, which is an HDL, you need to search which type of fat you need to ingest in your food. It could lower the chances of having a heart attack, which is something very good we need to do. What other things? People with diabetes are actually more liable to have it. Obesity, having a lot of people who are obese and having more fats in their body, they're more liable to have heart attack and family history of heart attack. Unfortunately, some people, even if they're extremely healthy, they could still have it because of a family history of heart attack. So what do we do to prevent it? The first thing we do is to have a healthy lifestyle. You need to have a regular exercise in your daily activity. You need to walk every day for like at least 30 minutes or 20 to 30 minutes. You need to have regular exercise. You need to move your body somehow. There's a variety of sports you can always play. Sports does not mean just walking in the gym. If they're boring for you, you can choose any sport you want. Just move your body to make the circulation better. You need to have a healthy diet. We need to have more vegetables. We need to have more fruits, more protein in our diet rather than fats and carbohydrates. So in order to avoid having risk of diabetes and heart disease and all of that. It's actually very common to have heart disease. So you need to have a healthy diet. You need to also take care of yourself. You need to take care of your mental health because the stress is one of the main leading causes of heart attack. Actually, stress could cause a heart attack out of nowhere because it affects your body in every single way possible. So you need to take care of your mental health as well. So all of that, even if you do eventually have a heart attack, what do? We go to the doctor, and after being fine, and some people have already some symptoms to make them feel that they have it, like something called an angina or chest tightness when they have exercise. Some people get very pain in their chest when they walk a few meters or do some exercise. This is not something you should not go to the doctor to. This is something very worrying. So you need to go to the doctor to have all these tests to make sure that you are fine. Even if you were diagnosed with heart attack, don't worry. We can actually easily treat it. It's not necessarily fatal and not necessarily causes death. On the contrary, sometimes we can treat it in the blood vessel. When you have a lot of fats around the blood vessel, just like we talked, we can put a mesh, a very small metal mesh, to make it open, to keep it open to the rest of your life. But if you did not change your diet, other vessels could actually have the clot, not this vessel necessarily. So could happen elsewhere and elsewhere and elsewhere. So even if you have it and you put the mesh, you need to always have a healthy lifestyle, and you need to always have medications. The doctor will describe medications to take to the rest of your life. So please make sure to protect yourself. Make sure to go check yourself. You can have regular checkups to go to make sure your heart is fine and your blood is fine, especially above 45 in males and above 55 of age in females. It's very, very, very important to prevent, because even if sometimes we save your lives, it still can be very, very deadly, especially if you have no symptoms. Please stay healthy, please exercise, please eat well, and if you have any questions, let me know. Thank you so much for watching, and always make sure to protect yourself from all these diseases and get your regular checkups. Thank you so much, and I'll see you next Tuesday. Have a good day.